So, what do we need to do now that we're not doing to control the spread of COVID-19?
So there are a number of things that DSPs can do, both with the persons they support as well as with their families and friends. It's really important to educate yourself about COVID and to really understand why it is so important to help stop the transmission of this virus. And really, really important to support and encourage people to get vaccinated, to get information on the safety of these vaccines and on the effectiveness of these vaccines. People have a lot of questions and they turn to people they trust. And so that's one thing that would be really helpful. And also helpful in working with the persons that you support. Also, to encourage people to take simple prevention measures, especially when there is a lot of COVID, a lot of SARS-CoV circulating. You know, I like to use the metaphor of it's raining COVID outside. So, you know, now is the time not to go to a crowded movie theater. Now is the time, if you're going out in public, to wear a mask, to be careful who you interact with, to ensure that you stay home when you're sick and wash your hands thoroughly, and to be up to date on public health guidelines and to look at trusted sources of information, such as from your local health department or from CDC. And more specifically, it's a good time to sit down with the people you support and to update care plans and to plan for what to do if you can't provide that support, who can help them, and to educate them about symptoms of disease and to understand when and who they should contact if they need to connect with a healthcare provider. Also useful to provide ways to communicate in an emergency in more than one way, in case your phone is out of juice, that you have another way to communicate. And also, we do recommend to work with people to ensure that they have at least a 30-day supply of prescription medications and that they have several weeks of groceries just in case they get sick or the people that are helping them get sick and they can't make it to a pharmacy or to a grocery store really quickly. I also just want to add in just a couple of more things quickly to recognize that really we're all in this together, and the choices that each of us make does have impact on other people in the community, even people you don't even know. And finally, to recognize that this pandemic has resulted in a great deal of stress on DSPs and on the persons they support. Great deal of stress, including having to take care of sick family members, having to deal with lack of childcare at times, or to deal with homeschooling, to deal with isolation if they get sick, or quarantine if they're exposed, and the economic impacts of the pandemic. And a lot of impact has also been on the people you're supporting. They're not as able to go into the community. They're struggling with loneliness. They're struggling with anxiety about if they get exposed or their family members get exposed. And really, all these things have a lot of impact on mental health as well as physical health. And it is important to be able to recognize the symptoms of stress and anxiety, depression, post-traumatic stress disorder. We do have information posted on our website for healthcare workers on ways of dealing with the stress associated with the pandemic. We also have information on our website for the general public about dealing with stress, and there are many, many other resources out there. So important to be able to recognize the symptoms and to know where to go and how to manage the extra stress that all of us are experiencing.
Thank you so much for talking about that. The additional stress that everybody has due to the pandemic has really taken its toll on people. One of the things I was also thinking about that we don't often mention is I think sometimes the pressure that people may have maybe from family members or friends about taking precautions. And I would just want to say, ask you, what would you advise someone if, they were kind of getting some pressure from family or friends to not wear their masks and not take those precautions? What would you advise them?
I think we were going to talk about this a little bit later in the conversation, but I think it fits really well here as to what DSPs can do and what should they know. And so education is very powerful, and so as we're talking about not wearing masks or not implementing infection control procedures, I think having that education and that foundation to really speak to why we're doing what we're doing, why we're hearing, wash your hands, stay 6 feet apart, wear your mask. And, there really is science behind that. And so I would just, really challenge DSPs to really take part in education, to look for how can I educate and further understand this a bit more complex, these more complex issues so I can speak to it. And, so if they can educate themselves, they can share that education with other staff, with the people they serve, and with their families. And one thing I would just really like to say is DSPs are, they're the trusted individuals of those they support. They see them every day, they know them, they have that great relationship. So really what they're telling the people they support will really carry a lot of weight. If you're hearing something from TV or messaging from, somebody at MDH that you don't know, that DSP is going to be able to make more of an impact with you wearing a mask or maybe getting vaccinated. So I just really encourage DSPs to really continue to seek out education and really leading by example and then explaining those concepts. They know and understand the people they work with and, the people they support and, how to message that to them. Or, each individual is going to receive messages different. So they understand maybe how to explain that in terms they'll understand or in ways that will really have that message received. I would like to share, one educational resource that I think would be really valuable. And CDC has launched an initiative called Project First Line. And it's been out for about a year. And they have a lot of short educational videos that are about 5 to 10 minutes in length. And for example, they have one on how does a virus spread, or why do I need to wear my mask, or why do I need to wear eye protection? And it's a member of the CDC really explaining those concepts so you can take that, understand that, and then share it with the people you support. Here in Minnesota, we've done surveys looking for, what would you like more education on? And one of the recent surveys that we did, I think somewhere around 56% of our respondents were DSPs. And the 3 areas they wanted more education on was transmission-based precautions, and one was source control, right? Using mask and eye protection when you need to. And then the third piece was triage or screening, picking up on those signs or symptoms that you really need to be aware of. And there are educational modules out there for them to get that training. So, DSPs, if they can have that really good understanding of ways to prevent transmission of COVID, that can really be very impactful with the people they work with or the people they serve to prevent illness.
Absolutely. Absolutely. DSPs really, they're a key to all this. in helping keep people safe.